In our series on medication adherence, I'd like to quickly make you aware of a very important concept, and that is the concept of compliance decay. And it basically tells us that patients on chronic medications start becoming less and less compliant over time. So just to give you some definitions, overall compliance would be the milligrams of the drug taken over the milligrams prescribed. So if that is less than what is prescribed, then obviously the compliance would be low or lower. Persistency, on the other hand, is the time on the medication without significant gaps in refill. In other words, the patient goes back to the pharmacy on time to get new medication. Now, I'm going to just use an example. Don't worry about the particular disease so much, but it's a good example of what compliance decay is and what the implications are. Now, you'd remember in Time magazine on the front page there was this picture of the new cancer bullets, and this was because of the discovery and development of a drug called imatinib. And imatinib became the most powerful drug ever at the time for a disease called CML, or chronic myeloid leukemia, CML. And why was this so exciting? Well, before the discovery of imatinib, the overall survival of patients with CML was only 50% at 5 years. And with imatinib, this improved to 85%, which was a great improvement, obviously. Now, the question that was raised was, how good was adherence to this drug? Because obviously if the patient is not taking the medication, he or she will not get the benefit. And this very interesting study was done by Tsang and co-workers and presented at the ASCO meeting a few years ago. So what they showed was that patients would start their medicine around here, full of enthusiasm, excited about getting this new magic bullet, so to speak. And for the first 4 or so months, they were really very compliant. But then you see that after the first 4 months, there was a dramatic drop-off in compliance. So that overall, at the end, what was seen, 50% of patients were 100% compliant, taking the medication every day. But the other 50% obviously was not. And this is a problem, because what happens to the patients who are not compliant? Well, another study showed us that their survival dropped down again to about 50%, which showed that very good compliance is an important, actually a critical factor in getting the benefit from the medication. In the same vein, persistency, in other words, staying on the medication without interruption, dropped from, and you can see the figures here, 94% at month 5, so that's about here, 94%, down to 23% only at month 14, 23%. That is a dramatic drop-off, and these interruptions have a big impact on patients' lives. The reality is compliance decay is a common issue with any type of chronic medication, not just imatinib. So be aware that your patients may become less compliant over time, so it is not something that you just speak about at the very beginning. You must reinforce the message of importance of staying on medicine many months and maybe sometimes years afterwards.